In the early days of oncology, treating a tumor meant relying on blunt force instruments. Doctors used early radiation and highly toxic chemicals with a single aggressive goal: eradicate the cancer cells at all costs. Today, modern chemotherapy is far more advanced, but it still relies on a difficult paradox. To kill the disease, you have to introduce severe toxicity into the patient's bloodstream. The treatment damages healthy tissues alongside the malignant ones, turning the healing process into a race to see which cells give out first. Tumors have actually evolved to survive this chemical assault. They hijack the body's own inflammatory response, using those signals to build dense, highly chemo-resistant microenvironments. They surround themselves with a biological fortress that actively repels the medication. The ultimate challenge in modern cancer care is developing a way for the patient to physically survive the cure while ensuring the tumor does not. This physical toll takes the form of cachexia, a severe muscle-wasting syndrome. It affects up to 90% of patients with certain types of cancer and drives a massive percentage of overall fatalities. Cachexia happens because the tumor's intense metabolic demands combine with the sheer physical stress of chemotherapy. Together, they accelerate the rapid breakdown of the patient's lean muscle and fat stores. But researchers have identified a specific biological intervention that intercepts this entire process. It's a tool that simultaneously weakens the tumor's defenses, amplifies the effects of chemotherapy, and halts cachexia in its tracks. The intervention relies on omega-3 fatty acids, specifically the marine-derived EPA and DHA found in high-quality fish oil. High-dose marine lipids provide a heavily researched, highly targeted mechanism that supports conventional medical protocols while protecting the patient's baseline health. To understand how it works, we look at a microscopic competition. Omega-6 and omega-3 fatty acids compete for the exact same cellular pathways. Excess omega-6 promotes chronic inflammation, helping tumors survive. But flooding the system with omega-3s overwhelms those pathways, actively promoting tumor self-destruction. EPA and DHA directly suppress the arachidonic acid cascade. This is the biological engine that drives inflammation. By shutting it down, the tumor is blocked from generating the signals it needs to survive. This specifically downregulates VEGF, a protein tumors use to trigger angiogenesis. Angiogenesis is the process of growing new blood vessels. Without it, the tumor cannot build the infrastructure it needs to feed itself. Before omega-3s even attack the cancer cell directly, they alter the biological terrain, completely cutting off the tumor's supply lines. Once supply lines have cut, omega-3s act as a chemo amplifier. EPA and DHA physically incorporate directly into the outer plasma membrane of the cancer cell. This incorporation makes the previously rigid membrane highly fluid. That fluidity sensitizes the tumor to harsh anti-cancer drugs, drastically increasing the amount of chemotherapy that can slip through the cell wall. Here is the paradox. While cancer cells become fatally vulnerable to the drugs, normal healthy cells react differently. The same fatty acids actually protect healthy tissue from the drug's severe toxicity. This protective effect extends to the rest of the body by reversing cachexia. Omega-3s block specific pro-inflammatory signals, like IL-6 and TNF-alpha, which are the exact triggers that cause skeletal muscle to break down. By integrating omega-3s into a treatment plan, patients transform their internal chemistry into a highly hostile environment for the tumor, yet a highly hospitable one for physical recovery and drug tolerance. That cellular theory translates directly into human clinical outcomes. The combination of targeted fish oil and standard chemotherapy yields incredibly strong real-world data. This bar chart compares standard first-line chemotherapy response rates in non-small cell lung cancer against a combined protocol. Adding just 2.5 grams of EPA and DHA daily more than doubled the favorable response rate, jumping from roughly 26% to 60%. Broader oncology studies show a 25% reduction in breast cancer recurrence for patients with high marine fatty acid intake and significant stabilization of lean muscle mass in patients battling severe gastrointestinal cancers. The clinical data confirms that marine omega-3s are a necessary force multiplier that improves chemotherapy success rate and overall patient survival. The focus of cancer nutrition has moved toward targeted metabolic intervention, treating specific nutrients with the same precision and rigor as clinical pharmaceuticals. This intervention is highly accessible. Clinical doses of 2 to 4 grams daily of heavily researched fish oil can dictate how a patient responds to their oncology protocols. While omega-3s are not a standalone cure for cancer, they are one of the most powerful, scientifically validated tools available in integrative oncology. Surviving cancer relies on combining the brutal efficiency of chemical treatments with the precise, protective power of natural biological modifiers.